And then, so our last but certainly not least presenter, we have Dr. Bienvenue Solal Nouboadinan. I did such a good job until that, I'm sorry, Solal. And she's coming to us from Chad and is going to be talking about increasing access to dermatology services through teledermatology. So welcome.
Good morning, everyone, and thank you, Kari, for your kind word. I'm Solal from Chad. I will be presenting on increased access to dermatological service through teledermatology in Chad. Situated in Central Africa, Chad is the 5th largest country in Africa with an area of 1.3 million kilometers square for 20 million population, and only 4 dermatologists for this huge people. The country is also endemic zone for neglected tropical diseases, most of which still need treatment and data collection. My motto has always been, healthy skin means good health. Dermatology field is seen as non-important in my country, and the scarcity of data on skin diseases at national level is very alarming. We also know that the ratio of dermatology to population is 1 to 5 million. This means that most people with skin diseases seek help first from untrained healthcare, secondly from traditional healer, consequently resulting in misdiagnosis, mismanagement, inappropriate management, misinformation, and also delay in the diagnosis of the deadly skin cancer in our settings. My journey for this project started in August 2024. Firstly, I had an online meeting with the HOD of Chad to identify the 10 pilot seats for this project. Through her partnership, an approval was granted from the Ministry of Public Health as well as provincial health managers and district to give us the detail on our 10 focal point. I then visited the district hospital, the Ministry of Public Health, as well as emailed the WHO in Chad for data on skin diseases, but available data is very limited. At GLODERM, we promote teamwork and building team. So I hosted a first face-to-face meeting among us 4 dermatologists which are working in public sector to present firstly the project to them, secondly to get their input, and thirdly to get them involved because teamwork will lead to this project to get a better outcome. This is me when I was visiting one of our sites at the Bitkin Hospital, discussing with the head of dermatology department. So far, where are we? We are able to set up a platform which is a WhatsApp-based to link for dermatology to all the healthcare workers. We collect 140 referrals with varying quality of pictures which are there. And why teledermatology is important, because each time when I visit the site, I had to do an impromptu clinic. This is showing that really the community needs a support from us. This is me training healthcare provider at our 10 sites on diagnosis and identification of primary health care dermatologists. So, if this project is implemented, what are we expecting? We will be having a first database on skin diseases in this country. We'll have an increased coverage on dermatological service to the community because we are going to have an involved community through this project, and a readily empowered and on dermatological services and a trained healthcare worker regarding on skin diseases. So finally, we'll have a mean for advocacy and lobby at national level to consider skin diseases as major public health concern. I cannot close my presentation without saying thank you to my mentor, Dr. Beatrice Etenesi, to GLODERM team, to ILDS, and I will ask you to follow us on Instagram and all the social media. Thank you.